Dr. James Wamboranyikal and the Member of Parliament for Nyakach, Mheshimiwa Aduma Ur. A day like this is the Minister's Day. Oh, the member of Nyando, my friend Jerry. Jerry is here. Now, on a day like this is the Minister's Day, but you know, health and education are very close together. It is because of Covid-19 that schools are closed. And the Minister for Education is facing a lot of problems with what to do with children at home at a time like this. I will therefore request the Minister for Education, Professor Magoha, to address you today, and then I will ask the Minister for Health, my friend Mutahi Kagwe, to address you. Professor.
Thank you, Your Excellency the Governor, my brother C.S. Kagwe, the Kisumu county government officials, the other members of parliament who are here, the provincial administration, distinguished ladies and gentlemen. I'm actually at home. And even at home, I can feel the heat. The people at the fence there are telling me open schools. But don't clap, because schools will not be open yet. I want to clarify for any avoidance of doubt that the statements I issue on behalf of government are after a result of thorough consultations with all education stakeholders, including those parents, some of who are out there telling me to open schools on Monday. And therefore, the issue of opening schools in January 2021 is still on. I want to say that there's a very false narrative, wherever it came from, Shetani Shindwe, because we never said that we are closing our schools indefinitely. We have always said, as for the time being, that schools shall be open in January. The reason why, after we met on His Excellency the President's order on the 30th of July last month to consult with regard to the TTCs, universities, and the TVET institutions, was because, according to information we are getting from my brother Mutahi Kagwe, this disease is actually real. The incidence is rising. It is killing people. And without naming names, the young ones, the millennials, when they have the disease, they think it is a joke. There are some who have already killed both of their parents and infected all their families. How many of you would want to kill your parents? Can I see by a show of hands? If there is none, please don't tell me to open schools. Can we be serious? Because the children are going to be super spreaders. By the way, that person who has killed his two parents is still alive and kicking. Yet the parents are dead 2 weeks apart. So this is not a joke. Can we take it extremely seriously? And I would like to ask the fourth estates that part of the problem must come from them. C.S. Kagwe did not bring COVID. I did not bring COVID. It is a health problem that we shall all have to deal with. Now, when government has consulted and decided that it is safer for our children to be at home, why do you want them to go and get killed in the schools? Why? So that position is very, very clear, that until we are able to see that COVID is coming down, and you can tell me whether the results of today are going to be any better, let us teach our children the way we have decided, again after thorough consultation, that we teach them at community level, at no charge. And every parent has something to teach his children. And I believe there are teachers everywhere. There's another matter, only one other matter I want to ask my people, because I come from here. And I thank God for it, and there's nothing wrong with culture. But times are abnormal. So we must change the way we bury our dead. Because God says, let the dead bury themselves. But Kenyans will say, no, let us bury our people. All this insistence of having bodies staying overnight in houses, can we agree together that it is time bad, and that we should bury according to the protocol that have been provided for us. And that when it comes to the actual burial, only the immediate family should come. You can still bereave from a distance. Remember, the distance is 1.5 meters. And I don't want to cheat you that I have seen any of that here in my home today. What I have seen are people touching me. How do you touch me if you are 1.5 meters away? So we can still be friends and work together, but in order for us to live to see tomorrow, can we be extremely serious with this COVID? And let me end really by saying that the government of His Excellency Uhuru Muigai Kenyatta is monitoring the implementation and the preparedness of schools on a daily basis. And we also said that the position of opening schools in January was not cast on concrete. Should the position change at any time, nothing stops us, together with you, from looking at the timetable and coming backwards or going forward. Now, when I say that, somebody says, no, I've now said we don't know when we are opening. Who has told you we don't know when we are opening? I said we're opening in January 2021. It could even be earlier. If we flatten the curve 6 weeks earlier, what reason will I have to keep the children home? But for heaven's sake, let us get there. I thank you very much for the opportunity, Mr. Chair.
Thank you very much, Waziri. Mr. Minister, before I call you to speak, let me just add one or two things. One, I really like to thank the leadership of Kisumu County, that is the county commissioner and her team, together with the cabinet members of the Kisumu government, my deputy governor Matthew Willie, who is here, and all the CECs who are here. I would also like to thank the assembly, led by the speaker, Jack Oraro, who is here with us. The assembly has been extremely cooperative in giving advice, in making sure that they pass our bills so that the COVID support can be adequate. Together with the county commissioner, we chair the county rapid response team, which involves both the people in the national government and ourselves. Let me also add, Mr. Speaker, Waziri, that I haven't forgotten my days in the parliament. Let me add also the private sector, with whom we have worked very closely, some of whom are in our COVID-19 rapid response team, especially in planning for long-term mitigation measures and supporting us with PPEs, personal protection equipment. But, Mr. Minister, as you have seen in your tour, my government has put in place very elaborate preparedness and mitigation measures. We have upscaled our isolation capacity spread across the county, while also enhancing our screening and surveillance at the border points and in the villages. To this end, Mr. Minister, I want to appreciate the seamless working relationship we have forged with the national government coordination and security agencies coordinated in the County COVID Multi-Agency Committee, which I co-chair with the County Commissioner, ensuring that surveillance, screening, and contact tracing is well coordinated. As you know, Mr. Minister, in order to ensure that COVID in this country in particular, where the incidence is very low compared to national statistics, that we must maintain it that way with proper surveillance, screening, and contact tracing. That is where the rubber touches the ground. Our isolation currently stands at 401 beds, Mr. Minister. As you have seen, the details we have provided you, beginning with these hospitals, the County Referral Hospital, Lumumba Hospital, and all sub-county hospitals, Mr. Minister. We also have a 21-bed critical care isolation here, to which you have been introduced. And at this particular hospital, we have a very good cooperation and working relationship with our staff, led by the CEO, Dr. Peter Okoth. We know, Mr. Minister, that in the final analysis, this cannot happen without the 2,400 health workers who have been sensitized on COVID-19 disease, with a further 405 having been trained on case management. At village level, sir, We have over 2,900 community health workers sensitized on COVID-19 and further 48 trained on home-based isolation. I also want to appreciate your ministry's support in enlisting 337 under the UHC program and COVID response. I would also like to thank the Maseno University in this regard in helping us work together with the call center, which has been extremely useful in tracing and in contact with Wananchi, getting their views, their worries, and their tribulations with the pandemic. Kisumu's unique positioning as a transport hub and the direct gateway to and from the border counties continue to expose it to possible escalation of infections. This has clearly manifested in the ballooning community transmissions, currently standing at 62% of the positive cases since the partial opening of the economy. We are acutely aware, sir, that this pandemic continues to depress the economy, and while putting a lot of pressure on the national county budgets, these constraints reflect on the overall capacity to carry out testing and other mitigation measures. Here in Kisumu, in order to ascertain with scientific confidence the level of infections, we believe that a stratified random sampling strategy would give us the best results, leading to a more coherent management planning. We have since ascertained that carrying out a sample out of 3,000 cases across various stratified groups will give us a very good information, Mr. Minister. Let me end there, Mr. Minister, and say that I want to invite you, Honorable Cabinet Secretary, to consider this view and allocate resources for this exercise for Kisumu as a pilot, which could be replicated across the country. I do conclusion, I want to assure you, my brother, Honorable Cabinet Secretary, that my government will continue supporting and implementing the containment management strategies and guidelines prepared by your ministry to maintain and contain this pandemic. To our people, I would say that you have been very good in helping us and helping yourselves to contain this spread of the pandemic. But please, and I want to emphasize, please keep social distancing, wash your hands as frequently as possible, and make sure that the appeal that has been made by the Minister for Education are practiced by you from now on, and also observing all those rules that we in the county have passed or have made regarding burials and other festivities to help ourselves and our people. I thank you, Mr. Minister.
Thank you very much, Your Excellency Governor Peter Anyang' Nyong'o, the Deputy Governor, Dr. Matthew Owili, the members of Parliament here present, the members of the County Executive Committees, members of the Kisumu County Assembly, waheshimiwa wale wako hapa, my friends from the Fourth Estate, Kenyans at large, I greet you, usaole. Asanteni. Professor Nyong'o, if I may take this opportunity to call him so, I would like to state I would like to be transparent from the word go, that Professor Nyong'o was my teacher, and he was also the Minister for Health at some point. So I am here delighted to be with you, and I would not be more delighted to be in this beautiful Lake City that is the foundation of a changing Kenya and its politics. When I informed His Excellency President Uhuru Kenyatta that I was coming to Kisumu, he gave me the humble task of bringing his greetings to the wonderful people of this city of Nyathi. Omusou, Opakroth, Asanteni. I also had the privilege of having a discussion with the Right Honorable Raila Odinga, who also said to me, when you get there, say majambo, and I greet his greetings. Umesipokea? Thank you, my brother, Professor Anyang' Nyong'o, for the excellent reception that you have accorded the team, my team, and ourselves, including my brother, C.S. Magoha, who we work with in the same team, but importantly, in the team that I chair, the National Emergency Response Committee or Coronavirus. And on their behalf, I also bring their greetings. Governor, as we were reviewing Kisumu's level of preparedness and the country's capacity to cope with COVID-19, a few things stood out as unique to your approach. And I'll be remiss not to mention, as they might prove very useful to others and other counties. As an example, Kisumu's use of technology through platforms such as bulk SMS, 24-hour call centers, is not only an effective means of raising awareness on COVID-19, but more importantly, a vehicle that offers the community the much-needed support in times of emergencies. Beyond this, Kisumu must be commended for its sensitization of police officers and NYS staff. You might recall that on the onset of COVID-19, we had a few issues that related to the police, particularly in the enforcement and adherence to curfew hours. Sensitization such as in your county was undertaken and is important and should be encouraged. One can rest assured that the police in this county are well trained to deal with the citizens fairly and firmly, but also in a gentle manner without creating danger to the public or to themselves. And I want to commend the police for the good work that they have continued to do. Notably, Kisumu is facing challenges that are worth mentioning, more so because they are not only unique to this county. Here, I'm referring to the misconception that COVID-19 is a low-risk disease, since the majority of the people claim not to know an infected person or an infected individual or a person who has passed on. I will not tire from stressing the fact that coronavirus is neither a national government nor a county government creation, or something we have any interest in propagating. This is not a disease you wait to see in order for you to take precaution. By the time you take a breath to run, you have breathed the virus. Na wewe kuisha kabisa. Donge? It is a known fact that one of the most effective ways of preventing its spread is social distancing, proper wearing of masks, and washing your hands. Therefore, even as the people of Kisumu grapple with the perception of COVID-19, it would be in all our best interest and in your best interest to cautiously approach mass gatherings, including funerals, as my colleagues have said, burials, weddings, etc., that we have previously taken for granted. As I have often said, these are not normal times. And if we treat this disease normally, you know what is going to happen. It is going to treat us absolutely. So you save me, and I save you. Bidding our loved ones farewell is important to each one of us and every one of us. However, it should not end up with greater pain or at the worst cost us more lives. And it's disheartening. It's disheartening. The story that C.S. Mahoga has said, and the one that I said yesterday, is really disheartening. When, as a young person, I don't know how you live with yourself when you know that you have killed both your parents and perhaps some relatives. What does life look like after that? That is a circumstance that we would not wish on an enemy, let alone a fellow Kenyan. And therefore, we urge that really we take the disease seriously, and these are times when we will not behave in our usual manner, but we will behave in a manner that will save our lives and loved ones. I'm informed, Bwana Governor, that many people in this county and many other counties are wearing masks these days. And when I look around, when I look in front of me, as I've traveled around Kisumu, I have noticed that people are wearing masks. I urge you, asanteni sana. I urge you to continue. Na yule aliniambia pale kwa mlango akaniambia yeye anataka mask ingine, nitatayarisha hiyo mask na utapata hiyo mask. And I don't tell a lie, so you'll get the mask. I'll give them to the governor. basi nitakupatia wewe mwenyewe. Kwa sababu kwa hivyo jameni, mimi nikuwasihi jameni, tafadhali washa sisi tufuate yale masharti tumesema kila siku. Tumesema tujipange, kila mtu ashunge maisha yake, kila mtu ashunge maisha ya ndugu yake na yule mwingine vile vile. Let me remind you that the act of wearing a mask, just wearing a mask and following the laid down protocols, is not a favor to a law enforcement officer. It is not a favor to the government. It is not a favor even to your friend. It is indeed a responsibility that we take seriously, because that is the one key thing. So ukiingia hapa, uingie matatu ama uende sokoni. Governor, I have passed some fantastic looking kiosks. Hapa nyinyi watu wa Kisumu, kioski zenu na vile mmejipanga na mambo ya viatu na mambo ya nguo, vile mmejipanga ni kama Ulaya tu. Hapa hakuna, you know, good. It's really smart. We are really impressed. It's fantastic. The city is clean. Kisumu city is clean. There is no doubt about it. Na mujivunie kukua watu wa Kisumu, because it is different. It's clean. And if we keep it that way, and we keep our places clean, because hygiene is part and parcel of prevention of this disease. We have seen it with our own eyes. We have seen the preparedness with our own eyes. We are particularly impressed because the Kisumu residents have taken it upon themselves individually to keep this place clean. Kuna kaunti zingine unaweza tembea ukiwa barabarani, ujui kama uko msituni ama barabarani kwa ile chafu iko katika barabara, lakini hapa unatembea hata karatasi uoni pale popote. Jameni, jivunieni hii sete yenu. It's looking good and clean. Inaendelea na tutaongeza ingine. Tutaongeza sio hiyo tu, tutaongeza ingine. Kwa hiyo tukiona vile inaendelea vizuri, tutapata hiyo hamu ya kuongeza. Hata wale watu wanafanya painting wataanza kupata kazi. Tutanunulia rangi, alafu wanaanza kupaka rangi town. Naona ninyi mnapenda kitu safi. Si ndio? Basi tutaendelea na hiyo kazi. But beyond this, I would also like to speak to a developing trend that is concerning us, and I think it is important for us to mention it here, and one that should concern everybody, especially in line of front workers and in line of what I've just said regarding gatherings and cultures. The Ministry of Health has issued guidelines and made recommendations in the past how the best PPEs are made, and KEBS in Nairobi has also made PPEs and measured international standards, according to international standards, and which are now being manufactured locally as well as exported from Kenya. So I wish to encourage all counties to ensure that our healthcare workers are protected by procuring and issuing the right protective gear. Those are our soldiers on the ground, and they deserve the best that we can offer. So whenever we get masks and so on, please let's make sure that they meet the standards so that they can protect our health workers as well as our citizens. Because as you all know, health service delivery is a devolved function, and the ministry has initiated what we all can do together in this regard. It has also been brought to our attention that there are a few doctors who are behaving very strangely, and this has been brought to our attention by the doctors themselves, especially those apparently in the private sector, who are undermining the process of protecting families by exploiting their emotions and colluding with some of them to ensure that barrier rights are observed normally. Some go to the extent of denying valid positive results to family members of people who die from COVID-19 complications with deadly consequences. When a person succumbs to COVID-19, they do so at their most infectious state, shedding the virus at a very high level, and therefore, when buried as regular fatalities without the protective measures in place, everyone who close to them is exposed. And we have mentioned today, and severally before, we are all vulnerable to COVID-19. Not even doctors are safe. So we should not, and I plead, please, if your relative, if your brother, if your sister, if somebody succumbs to COVID-19, let's just be honest. This person has passed, because anybody can die of it. So because of that fact, let us all be honest, and there should be absolutely no reason why a doctor should issue a negative certificate to a positive death so that the death can be a normal burial to remove stigma. We have said very clearly, stigmatization of COVID positives is a weakness in our society. And at the cost of making my own joke, you can get it. Anybody can get it. So let's not stigmatize this disease and say that here is a certificate, go bury the person normally, knowing very, very well that at that point, anybody coming close to that body is going to be infected. And so I urge, A, let's stop stigmatization. B, please, if you are a doctor, you have not. That is contrary to the professional ethics and vows that doctors ascribe to. I think my plea here, fellow Kenyans, is clear. Doctors, please protect yourselves as individuals, even as we at the ministry and county governments strive to protect you by providing PPEs. This is also an appeal to health officials to initiate posthumous testing where and when there is a difference in opinion regarding the cause of death. Please enable the bereaved and the grieving families to have proper closure following deaths of their loved ones by carrying out posthumous testing for COVID-19. This is the most prudent thing to do to ensure that we protect our public and the safety of the families and general public at large. I would also like to mention here today that Your Excellency the Governor, that our visit to Kemri today, Kemri here in Kisumu, is also, a mark to the development that as a country we are making, the progress as a nation we are making, because I don't know how many of you have visited Kemri, but it's a very impressive outfit. Research is going on there, testing is going on there, but we also learn as we go. Because one of the things that we have learned with our labs is that the purchase of closed systems where we cannot use reagents from other sources is also a challenge. And going forward, as I said yesterday, we will change this circumstance. We have also been very impressed with the research work that is going on here in Kisumu, just like they do in Welcome in Kilifi. But I've also urged that the research that is being done in Kenya, the data that is being created in Kenya, with the support sometimes of foreign institutions, we are cooperating with the British in Welcome Kilifi, we are cooperating with the Americans, CDC, here in Kisumu, but we must always remember that the findings that we get in our labs in Kemri or any other facilities in our nation must be mutually recognized. We cannot carry out research in Kenya using the brains of our people, export that data to somewhere else. Something is discovered, a medicine is discovered, a vaccine is discovered, and then it is not attributed to Kenya just because the research was being funded by somebody else. So we would like to urge those we cooperate with that cooperation must be meaningful, and it must mean that what we discover in our nation with our scientists must be mutually recognized and must be mutually owned. It cannot be taken elsewhere and we are assumed to have just been KYMs. We need to own it together, and we need to sell it. If it is going to be sold, we need to sell it together so that we all benefit. And that is something I am appealing to our partners within KEMRI, that we work together to ensure that that happens. Before I give the dairy figures today, I also wanted, Your Excellency, if you allow me, to introduce one or two people we had come with from Nairobi in the Ministry of Health. I don't work on my own, we work with a big team. But this time round, I just wanted to recognize the work of the nurses and the work that they are doing in hospitals, particularly those who are assigned to the isolation facilities and those who are assigned to case management in our various hospitals, particularly here in Kisumu, and I want to thank them all. So with me today is Edna Talam, who is CEO of the Nursing Council. Edna, where are you? Mpigieni makofi tafadhali. Thank you, Edna. Also, Professor Eunice Durango, Prof, who is chairperson of the Nursing Council. Mpigieni makofi tafadhali. We also have Dr. Susan Koki Mutwa, who is Director of Nursing, Director of Public Health. Asante sana, Susan. We also have Dr. Osman Wafa. Dr. Wafa, asante daktari. And Dr. Wafa is the head of. Thank you very much, daktari. Of course, at the head of them all, we have got Dr. Patrick Amoth, who is acting Director General. So thank you very much. I would like at this point to announce the numbers today, that we have got nearly 600 new cases, but 599 more COVID-19 infections out of a sample size of 4,420 over the last 24 hours. In total now, we have confirmed cases that stand at 26,436. Here in Kisumu, you are lucky because so far the numbers continue to be amongst the low ones. Keep it that way. The cumulative total in Kenya stands at 353,727 persons, Kenyans, who are within our nation. Amongst the new cases are some 593 Kenyans, while 6 are foreigners. On the basis of gender, 373 are male and 226 are female. I think women are beginning to come closer and closer. That's not a good thing. The youngest of the people tested positive is a year old, while the oldest is 82 years old. Fortunately, I am also pleased to inform you that today is the highest number of patients that we have discharged. So I'm pleased to announce that a total of 1,062 patients have been discharged. 79 are from facilities, while 983 are from home-based care programs. This is the highest number of discharges realized so far in 24 hours. This brings our cumulative discharges to 12,961. We sincerely give thanks to our medical staff for the work they have done to make that possible. However, on a sad note, we have also lost 2 patients in the last 24 hours, bringing our total fatality to 420 people. We condole those families because any one Kenyan dying of coronavirus disease is one Kenyan too many. According to the counties, the cases are distributed within Nairobi again as the highest number at 318. And when we were at the call center, one of the things, Your Excellency, you remember, the call center staff were telling us is that Kisumu people are very conscious of people who come from Nairobi, and therefore my advice has continued to be that if you live in Nairobi and it is not necessary for you to travel from Nairobi, you stay there for the time being. Weka huko tu kidogo, tuone vile itaenda, alafu uje hapa Kisumu. Lakini ukija Kisumu, please keep your distance, wear a mask all the time so that you do not infect persons living here in Kisumu. Kiambu County continues to rise, today at 70, Nakuru at 39, Machakos at 38, Mombasa having been going down, but today a bit high at 28, Kajiado 26, Isiolo 10, Kericho 14, Kisii has 9, Kakamega has 6, and the rest of them follow. Makueni with 5, Kisumu, today you have also recorded new cases at 4. You have got 4 new cases in this county, and you don't know who. It could be the person right next to you. Yep, it could be the person right next to you. Hebu angalia vizuri. Anaweza kuwa ni huyo. Lakini sio kusema ati ni mtu mbaya, ni kusema tu ujikinge kwa sababu inaweza kuwa jirani wako. Kitui also, Murang'a has also recorded 4 among the others. So at this point, ningetaka tu kusema tafadhali nimpe wakati. I want to give members of the Fourth Estate the opportunity to ask 1 or 2 questions, and then we can call it a day. My friends from the Fourth Estate, any questions?
Can you come over to the mic and ask?
Yeah, they're here. Okay. And please say who the question is towards.
Okay. Good afternoon. Okay, my name is Kevin Omolo from Standard Media, Standard Newspaper. I have several questions for CS Health.
You can ask 2.
Okay. One, you had alluded to the issue of the standard of masks. And there was a report, I think, 2 weeks ago from KEBS of a number of substandard masks. Some of them were already in the hospitals being used by health workers. So I just want to find out if you have managed to recall all the substandard masks and PPEs which are already in circulation. Secondly, you have visited Kemri and you mentioned that they are doing some good work. And previously, you had advised the counties to ensure that they have testing centers. So do you think there is still need for each county to have their own testing centers, or the counties that are surrounding the Kemri in Kisumu can use Kemri in Kisumu and spend the rest of the money in the other places such as getting PPEs? And finally for you, the issue of blood shortage. As you know very well, schools have been the major source of blood in the country. Maybe if you can share the status of blood in Kenya, and if there are any intervention that may ensure that you don't go so low. I have one for Professor Magoha. For Professor Magoha. Now, you have mentioned that schools may reopen anytime soon, but looking into the statistics of private schools that have been closing anytime, a number of private schools have been closing. I know of some because I've been affected. Do you think should the schools open within the next 6 weeks you are talking about, or next year? Will the public schools be in a position to hold all the children who are coming out of the private schools? And if so, how easy will it be for the parents to get the chances in these public schools? Thank you.
Please, can we please ask 1 or 2 questions so that others can get an opportunity? Please.
Yes, good afternoon. My name is Doreen.
Sorry?
My name is Doreen from NTV. I have a question. There are reports that money have been lost in KEMSA and there are corrupt deals in the ministry. How much has been lost? Secondly, there are political leaders who are calling for your resignation because of the backstop with you. Will you resign? Lastly, only lastly,
No, 2, man.
there is a video of your son at a house party, yet you spoke against this. What is your comment on this? Thank you.
Good afternoon. My name is Chris Mahandara from Kenya News Agency. Chris Mahandara from Kenya News Agency. My question is directed to CS Kagwe. You talked of ongoing research. Would there be any research on why the bulk of our cases are asymptomatic? Okay. And would that in any way be related to the spike in the number of cases?
Yeah, sure.
One last one.
Jambo, mimi naitwa Oliver Ochieng kutoka Radio Sahara. Nina swali moja kwa waziri na kisha swali moja kwa governor. Tukianza na waziri, ni kwamba umezuru maeneo ya Kisii, umekwenda Kakamega na sasa uko Kisumu. Je, kuna kitu ambacho natoka nacho pande hizi ambacho umejifundisha ambacho kitasaidia katika vita dhidi ya virusi vya corona ambacho huenda ukaambia magavana wengine kwamba pate kuzingatia ikizingatiwa safari zako katika Kakamega, Kisumu na kisha Kisii? Kisha Gavana Nyong'o umezungumza kuhusu mchakato wa kupima baadhi ya wakazi wa Kisumu na ni jambo ambalo umezungumzia kwa mara ya tatu sasa ikiwa siku ya tatu leo. Je, umefikia wapi na mpango huu? Na mpango wa kuwapima baadhi ya wakazi wa Kisumu ili tujue kwamba wangapi wana virusi tayari.
Okay, sawa.
Naam. Alafu kisha nikuulize swali la mwisho, ni kwamba kwa sasa hivi umedhibitisha visa 4 vya corona hapa Kisumu. Utuambia wakazi wa Kisumu kwamba tukufikia sasa hizi ni visa vingapi vimeripotiwa Kisumu, watu wangapi wamepona na kadhalika. Asante.
Good afternoon, sir. My name is Caroline Wafula from the Nation Media Group Kisumu office. I want to know, we have seen numerous strikes across the country by medics, and in this region alone, currently we have Homa Bay, which has finished which has been on strike. The medics have been on strike for the last 1 week, and tomorrow, if we are not careful, Nyamira and Siaya will be joining in. Kisii, they went back last week after the governor promised that he's going to pay the salaries by Tuesday. How are these strikes impacting on efforts to contain the spread of COVID-19? And then on contact tracing, sir, are we doing enough from where you sit? Are we doing enough, or our county is doing enough in terms of contact tracing, which is very vital in the containment of this disease? And then I don't know whether this goes to you, but surveillance at the border points. We see a lot of influx of people coming from the other countries, our neighbors. And are you satisfied that we are doing enough at the border points in terms of safety?
Thank you,
sir.
Thank you, Caroline. Let me start with let me start from the top regarding the issue of masks that are supposedly raised by KEBS. I'll tell you something. I did take myself to KEBS. I took some Chinese PPEs and they failed the tests personally. So goes forthwith, we have not imported Chinese products because the Kenyan products are good enough or not even better than the ones from elsewhere. So on the issue of the medical ones, on the medical on PPEs, we have ensured, including the medical masks, that what is being taken to the doctors are what is the doctors themselves have approved. In fact, I can tell you that even after KEBS approvals, I still insist that our doctors, Dr. Ogola, Dr. Nandiri, that they still go ahead and look at those PPEs before we launch them out. Because, you know, we cannot experiment with our medical workers. On the issue of Cambry and testing center in each, I think, Omoro, that's an excellent question. And in fact, we discussed it today at Cambry. Obviously, if we can expand testing, it is better. But in the initial stage, regional testing facilities are what is assisting us. As you know, it's expensive. It's expensive to establish testing centers. But because this is not the only disease that is going to affect us, we are going to expand testing even into other counties to shorten the time that one needs to be able to get the results as quickly as possible, which helps also in terms of contact tracing and isolating before the person infects other persons. We have had shortages in blood, you are very right, because as you know, we had some, shall we call them institutional issues at the blood level and the management of the same all the time since for the last 2 years or so. The action that I have taken is I've changed the management of the blood management. There is a bill in Parliament which soon will be with us to create an institution that is going to be managing blood slightly separately from, instead of managing blood as a department, we manage it as an institution. And we will be making very fundamental changes in that area. We have already selected a head for that unit, Professor Nduku, who is going to be managing that. And therefore, yes, we have had issues, we have had challenges, but we are addressing them. And we'll make sure that Kenyans have got blood. But also predicating the management of blood on ICT, so that the theft of blood, believe it or not, we have had blood being stolen. And therefore, what we need to do is to ensure that predicating it on ICT, we are able to trace blood from the person who gave the blood to the person who eventually receives the blood. So these are fundamental changes that we are working on at the Ministry of Health. And soon, you'll be happy to know that these are not things that are taking a lot of time, a long time. Doreen, your question regarding corruption and the issue at KEMSA, yes, of course, we have read the same things that you have read. We are aware that there are investigations going on. Some of them started long before I got there. So the issue of anybody asking me to resign is what is called a pipe dream, and they can continue dreaming the same. I'm not even aware who that is, by the way, Doreen. I'm not sure whether it is you alone or other people, but you can tell them to dream on. On the issue you asked about my son, I do not have a son in my house who is less than 18 years old, which means that they are adults. You can follow them and ask them. As for research in the KNA, as for the research that Chris, you spoke about, the issue of asymptomatic issues, people who are, has the research shown anything about the reasons why Kenyans continue to have, to be fairly asymptomatic? I don't think the KEMRI has quite discovered yet why that is the case. And we hope that that is what is continuing. And indeed, even in our discussions with the research organizations, even outside this continent, they have continued to say it will be interesting to see and to understand and find out why that is the case. Of course, we are still in the early stages of the disease. We don't know what might happen tomorrow, but so far we are holding on. And we want our research people to continue on this to find out indeed why this might be the case. Otieno, on the issue of use of, is there something? Kuna kitu tofauti nimeona hapa Kisumu ambacho ni kitu ambao wengine pengine counties zingine zingefanya. I think one is ICT. This is the only county that is predicating the use of ICT to the extent that I have seen here. The second one is, I think, except for Nairobi County, except for the national government, this is probably the only other county that has got a call center where people, citizens can call and get response. Now, obviously what is going to happen is that it is not going to be all the time efficient. And I know that there are questions regarding, even Honorable Shabila had asked a question regarding somebody has called and it is not being answered on time. These are issues that will be there perhaps, particularly because of shortages of personnel and so on. But I want to specifically thank Maseno University. I want to thank Maseno University for the excellent support that you have given Kisumu County. Thank you very much. If we do what is being done here in Kisumu, if all other institutions, universities in the various counties are also working together with the county governments to do the kind of things that Maseno University is doing here in Kisumu, I think we will be so much better off. So I want to say that that is a carry away from here, and I appreciate to the other counties so that they can also establish a similar thing. And yes, in every county we go, there is always something that other counties can also borrow. In Kakamega, you mentioned Kakamega, for example. Yesterday we saw an extremely futuristic project that has been put together as a future level 6 hospital, not just for the region, but in fact for the country, as well as possible, even the international community within this African area. So every county has got something to offer other counties, and we are so glad that devolution has taken the kind of space that it has taken in our development, plans, and succeeding in bringing services to the people. So yes, there is always something that you borrow from another county. As for Caroline Wafula and the strikes that are there in various counties, I've got two things to say. Number one is that it is always a good thing for us to discuss and find out why the situation is the way it is. For example, there has been delayed in salaries. And sometimes when there is a delay in salaries, it is not necessarily because the governors don't want to pay. Sometimes there is a delay even from the Treasury. And the best thing to do all the time is to engage so that we can have that understanding that it is not that the money is going to be taken away by anybody. Sometimes there's a delay, and I understand completely the pain that it causes people. You have got rent to pay, you have got school fees to pay, you have got food to buy for the children and the family and so on, and I sympathize and understand completely that situation. But I think it is always good to talk about it and to engage the county governments who are the front line on this particular issue. The second thing that I would like to do is to appeal to health workers and the medical fraternity and to ask you in the humblest manner that I can to kindly, when we have the kind of situations that we have, when we have the epidemic that is in our midst, I would urge you that you go that extra mile. You are already doing it. You are already fighting. You are already a soldier in the front line. And I would just like to urge you, when those circumstances and challenges come, please think about the patients as well. Think about those we are leaving behind. Think about the suffering that it might cause. And if you do so, then I'm sure you'll say, okay, I'll wait. Let's talk about this thing and let's try and save our people as much as we can. So I just want to urge that. I want to take this opportunity to once again say we appreciate, the government appreciates, the Ministry of Health appreciates exactly what you're doing. But when you are faced with some of these challenges, take a second breath and let's talk together before we call a strike. On the issue of contact tracing, here in Kisumu, we have urged the government of Kisumu that this is a very opportune time for the Kisumu government to really contact, trace, and isolate, because they are very isolated cases as we speak. And those cases can be contained if we work as fast as you are, because I know there's a lot of good contact tracing going on. So am I satisfied? I think it can always be better. We can always improve these things, Caroline. We are not at the apex of our best, but I can tell you that there is a lot of good effort that is going on. And sometimes we are victims of our own success. The Kisumu government can be a victim of its own success because of the success they have had in terms of containing this disease. Then it can look like there is no disease happening. It is because of what they are doing. That's why it is not spreading as much as it could. So contact tracing is an important part of it. On the issue of home-based care, I think I'll ask Dr. Amoth to talk a little bit about home-based care in Kisumu. And one of the other unique things about the home-based care in Kisumu is that they are actually training people as well as in Kakamega as well. They are training people. We want to extend that further to train families. Any family with anybody with COVID-19 person can be trained so that they can also be part and parcel. As we extend our defense structure from the doctor to the nurse, healthcare workers, healthcare volunteers, and now on to family members. I think this is how we are going to win this war against this disease. Over to my friend. I think first, my brother can respond to the issue of, maybe Dr. Amoth can finish that, and then my brother I can leave it to my brother to talk to his section. Thank you very much, I appreciate it.
Thank you, Waziri, Excellency Governor, Cabinet Secretary, Professor Magoha. Home-based care, by definition, is basically trying to take care of a sick person who is relatively stable in a home setting under the supervision of a trained healthcare worker. And if you looked at the statistics that we have relayed today, majority of our discharges are actually coming from the home-based care platform. It is 9 times cheaper than institutional care, meaning that we can be able to allocate resources for other things instead of institutional care. It is important that during home-based care, you first of all meet the criteria that is set out in the guidelines that we have shared with the counties both in English and Kiswahili, and we have implored the counties to be able to have an abridged version in a local dialect so that when we go to the community level, the household level, then people will be able to understand what home-based care is all about. This is a platform that we have used before during the advent of HIV, and because of the burden of HIV disease in this area, we are basically experts at home-based care in this particular region. We have trained community health volunteers who will be able to assist us in monitoring those people who are under home-based care. And so far, as of today, we have discharged more than 8,000 people from the home-based care platform without any mortality. So this is the way that we are going to go going forward, because we also be saving a lot of resources. What has been trending on the social media that I want to clarify is, of course, the basic things that you need to undertake when you are carrying out home-based care or you are under home-based care. One is to ensure adequate nutrition. You eat foods from all the food groups, have some protein. We are near the lakeside, you can be able to get omena or fulu or whichever type of fish. Of course, animal-based protein is better because it's readily bioavailable, but if not, plant-based protein is equally works well. The lentils, the dengu, the beans will work well. This is important because when you are sick with COVID-19, you need to produce proteins called antibodies, and you only produce them from the food you eat. We'll continue to preach. I don't have any problem with your lemon, ginger, garlic. Take it as much as possible because these are immune boosters. They have micronutrients, they have antioxidants, and if you have an infection like COVID-19, the infection causes release of chemicals that can damage the rest of the body, and therefore these foods are very, very important, including the green leafy vegetables, the spinach, the kales, and any other local vegetables that you can lay your hand on. It is important that you take those plus fruits, which also gives you essential vitamins to help strengthen your body. Number 2, you require adequate rest and sleep, 6 to 8 hours of sleep in a night, so that your body can rejuvenate and recover from the insult caused by the virus. Number 3, you need to do some level of exercise. You can walk around your compound or where you are for about 30 minutes each day. That will also boost your immunity. You need to be properly hydrated, take adequate amounts of water, because water will enhance perfusion and therefore will be able to make all those cells that are helping you fight the virus move to the right place and kill the virus-infected cells through your body's natural immune system. We would not encourage you to smoke. If you're a smoker, please, during that period, stop smoking. You should also stop alcohol intake or reduce it at least. If you do all that, then you'll be in a better position to be able to come out of home-based care very, very quickly, as statistics that were shared to us in the boardroom today. So these are some of the quick measures you can be able to put in place, which don't require any investment. Of course, you require psychosocial support from the rest of your family and adequate vitamin D. Kisumu, you have the advantage that you have the sun throughout the year. Please bask in the sun for about 20-30 minutes every day to improve your vitamin D status. So if you are able to practice all that, then you have a better chance of quick recovery from home-based care. But there was also a question that was asked about research regarding why many of our patients are asymptomatic. We think possibly it is because of our youthful population. If you look at the person next to you, the average age of the people who are here is about 35, 40 years. So compared to what happened in the West, where majority of the people who succumbed were elderly, more than 60 years, therefore have a risk of more comorbidities, including hypertension, diabetes, and all those other diseases. We hope our demographic profile
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain.
If symptoms persist, seek medical advice.
Pata smartphone mpya kuanzia 20 bob daily pekee ukilipa mdogo mdogo. Weka down payment ya 1000. Lipa kuanzia 20 bob daily kwa miezi 9. Piga star 544 hash kuona kama unafaulu kupata 4G Neon Ray Pro. Si hapo Safaricom ni yako kabisa.
From far with you.
Kabisa.
I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
There are different types of sickle cell disease, but the most common type in Kenya is sickle cell anemia.
Patikana kuna sickle cell anemia. Kuelezea babake, alikasirika. Mother-in-law akamsukuma sana apate mke mwingine mwenye atampatia watoto wazima.
My pain usually comes like turn after turn. It feels like somebody is ripping off my skin and inserting broken glass into my veins.
There are several things that can trigger off a crisis. Low temperatures, cold weather.
We take time to understand sickle cell anemia and the challenges that sickle cell warriors have to live with.
Did you know there's a laundry bar soap that can help save you time, water, and money? You save by not having to use multiple products. And you only rinse once. For a laundry soap that can help save you time, water, and money, try Whitewash Extra. Brand power, helping you buy better.
NTV, turning on your world. The following program has been rated PG. It may contain scenes unsuitable for children under the age of 10.